Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. Today, we're going to be talking about how acupuncture and other integrative approaches can be used to treat depression and other types of mental illnesses. I have Diane Lee. She is an acupuncturist who is also a self-care specialist, integrative medicine practitioner, and holistic health expert. She was a pre-med student turned acupuncturist, herbalist, and Reiki Master with over 20 years of experience and specializes in women's wellness, specifically adrenal fatigue and stress, hormones, and digestive imbalances, all of which can actually cause individually on their own depression. She has a private practice in an integrative clinic in Austin, Texas. Diane is a perfect blend of science and woo, incorporating acupuncture, herbalism, the esoteric arts, body work, nutritional consulting, sound therapy, and crystal healing into her multifaceted medical practice. Welcome, Diana.
Thanks so much.
Yeah, so I love what you're doing, and it's always nice to be able to interview people who are utilizing alternative methods of treatments for depression, because there are so many people out there that just don't respond to medications. They have side effects from medications, or they do respond and it poops out, or and then they find themselves taking more and more medications and then develop side effects from the combination. So it's really great to be able to offer other modalities and maybe a combination of things, but really getting to the root cause of the problem. And I would love to learn from you about how acupuncture can do that.
You know, I love that you already brought up this concept of root cause. So I call myself a root branched practitioner. You can treat these symptoms all day long, the things you see on the surface. But if you're not getting down to the constitutional imbalances, you're kind of just treading water. You're not actually creating change in the body, because we have to figure out why a person is feeling a certain way or experiencing a certain thing. And that's what I love about Chinese medicine. You know, when I became disillusioned with the Western world in my undergrad program, I quickly realized that they were just putting a lot of band-aids on things. They were patching things up, but not really figuring out what, when, where, why, or how people were ending up where they were. I was literally told, I don't really get a chance to talk to these patients about their lifestyle modifications or the McDonald's cup they're throwing out on the way in or smelling like alcohol and cigarettes, and that they would probably be back in the cardiac rehab internship or cardiac rehab program in 6 months. They would be lucky if they made it 5 years. And I thought, there has to be a better way. There has to be a way to catch people before they're at this kind of end of life care. So I looked into everything like Ayurveda, naturopathy, OT, PT, stopped studying for the MCATs and jumped ship to the east side. I got into traditional Chinese medicine because it's so comprehensive. We're talking mind, body, soul, the things we eat, the people we surround ourselves with, even the colors that we wear, as a more comprehensive system to figure out why people end up with these imbalances. There are typically some primary imbalances that we look for in Chinese medicine, and mental health can, like you said, stem from a bunch of different sources. It could be from hormones, it could be from digestion, it could be from mold in your environment, or it could be that you hate your job and you need a way out. So that's what I love about Chinese medicine, is it really looks at the whole picture.
That's great. Yeah. So do a deeper dive and into specifically how Chinese medicine can help with depression specifically. What are the things that you're noticing, and how do you approach it?
So there's this concept in Chinese medicine called the Shen. Now, there's not like an actual translation for this word, as with many Chinese terminology, like qi. Qi is this vital life force, right? What we know now, as science has finally caught up, is that qi and ATP are the same thing, right? Is the action potential. It is the energy coursing blood through the veins, sending lymph through the system. And qi is kind of the foundation of our vitality and our life force. But Shen is this kind of overarching concept of heart, mind, consciousness. There's not really a spirit translation or word translation for it beyond this idea of the light behind the eyes, right? You can tell when somebody's vibrant and alive and happy and on fire and in their body, right? Versus you can see when the lights get dimmed, especially in experiences like depression. You can just sense that there's kind of this air of the Shen dissipating or not being as shiny and bright. So when we get down to this concept of Shen, which is also in relationship to the two other treasures called Jing and Qi, right? Jing is the
Mm-hmm.
primal essence, right, that is given to us from our parents. But Jing, Qi, and Shen basically comprise our existence. And depression and Shen disturbance, as we call it in Chinese medicine, are very well correlated. Now, Shen disturbance can have a couple different varieties, right? Because anxiety could also be considered a Shen disturbance. Psychosis could also be considered a Shen disturbance. And these are a spectrum of mental health. So
Mm-hmm.
when we talk about depression, we're talking about Shen disruption in a way that the lights have been dimmed, that things are just turned down. And the
Mm-hmm.
premise of Chinese medicine is to find balance in the body. So we look at multifactorial components of this, right? What kind of foods are they eating? I know for me personally, I fine tune my system to a point where if I eat foods that are not in alignment, I can feel it in my Shen. I can feel a sense of anxiety or weepiness or depression,
Right.
like symptoms, if I'm not eating the right things. It's also environmental, right? A lot of times when we are in a symptom of depression or experiencing depression, we don't want to do anything. We're not moving our bodies. We're not spending time in nature. We're probably not nourishing ourselves with the people, places, and things that help us get out of that rut, because it's easier said than done when we're experiencing depression. So Chinese medicine really looks at the constitutional imbalances. We get all the way down to the foundation of everything, which is yin and yang, right? Is there an imbalance of yin and yang? And then consequently, the Jing, Qi, and Shen in the body.
Mm-hmm.
So we focus on boosting the Shen, on nourishing that heart-mind connection and helping bring the light back on through things like lifestyle modification, maybe recommending literally spending time in nature, right? Tree bathing. I recommend scream therapy to a lot of my patients who are dealing with depression because it's often due to some type of pent-up emotion or repressed sensations that we haven't been able to process, often related to anger and the liver. And so sometimes you just got to scream it out, right? You just got to go and let this energy out and allow room for these emotions to be part of your life. So we really are looking for the multifaceted aspects of what could be imbalancing the Shen. Is it
Mm-hmm.
coming from a situational experience, or hey, maybe you are totally in a space where it's just okay to experience a sense of depression. I don't think we're taught that it's okay to be sad and upset. Like I had a patient whose father died, and they're
Mm-hmm.
like, I think I'm depressed. I'm going to go get on a prescription medication. I'm like, well, do you want to not feel anything? Like, are you wanting to not process these emotions? Because being in a depressed like state in an experience like that, it's totally normal. I'd maybe
Mm-hmm.
be a little more worried if they weren't experiencing these symptoms of grief and sadness and Shen disturbance in that moment.
Right, right. I agree. I agree with you that there is going to be a certain population that has these emotions. Grief is in particular, and nice to have counseling around that about processing those emotions. And sometimes taking medications do numb your emotions and not allow you to process them, especially if you remain on them long term. So it is a quick fix, but if it's so it's a matter of making those decisions that the benefits outweigh the risks. And so if you're had a loss and you were suicidal and or couldn't function, that's where those kinds of medications are really help to keep you safe. And so it's a matter of really finding where they are on that spectrum and making sure that this is not an emergency, and that's the best, that's one of the alternatives, but it may not be the best alternative for your specific situation. So it is really, really important to see professionals to determine that. And so when you determine that you're safe, you are functioning and it's a more of a milder or moderate kind of reaction where it's not interfering in your ability to function, or you're not putting yourself in self-harm, then it's looking at these other modalities. I agree. So sometimes medication can be overkill for a situation, but it also might be the right thing for that particular person. So it's really important to see professionals, like myself or like you, to be able to figure that out, and make sure that it's the right thing for that person. So when you talk about traditional Chinese medicine, how does that translate to acupuncture? And is that connected in some way to acupuncture, or is it different? And I'm asking you that because there might be people in the audience who don't know the difference. So if you can talk about both, that would be awesome. Whether they're the
Yeah,
same or different.
absolutely.
Yeah.
Totally. And on what you were saying, I totally agree. Western medicine has its place. It is an incredible modernization of what we're able to do. And it is so important to work with qualified professionals. I refer my
Right.
patients all the time to have a healing team, right? It's so
Right.
important. Tell them to go get mental health support, go get chiropractic, go get
Right.
massage, right? And see their Western medical doctors as well. And you really attested to something that medications can be helpful. And unfortunately, sometimes the side effects of the medications can be even worse than what they're trying to treat. So I
Mhm.
love looking for multifaceted approaches before going to things like that and making sure that they have the right mental health support, doing things like EMDR and tapping and so forth. But on to your other question about Chinese medicine. So acupuncture is a component of traditional Chinese medicine. So over the course of about the last 5,000 years, this practice has become widespread, international, and you can even see it utilized in modern medical facilities these days. So most cancer clinics are starting to go, wait a minute, or the VA, for example, is doing a
Mhm.
lot of research for
Right.
us around acupuncture and pain. So there are kind of a
Yeah.
few different aspects of what traditional Chinese medicine comprises. Some
Mhm.
of it is the acupuncture component. There are many schools where people train in just acupuncture, and
Mhm.
some of it is the herbal component, right? There are a lot of people who become herbalists, and that's their primary focus. But
Mhm.
there's also these components of Tai Chi and Qigong, which kind of fall under the umbrella of traditional Chinese medicine, or these other components of, like, we studied Hakomi in school, for example, which is a Japanese art of listening and trauma response approaches. And so it really has a far-reaching scope of what it comprises, but acupuncture is kind of one of the subcategories under traditional Chinese medicine, and classical as well.
Great. I love that explanation. You really encompassed all the different areas very, very nicely. Because it depends, there's a variety of people in the world and they might not have been exposed to any of that yet. Hopefully they will at some point in their life, because I have gotten a great deal of benefit from acupuncture. And I think it is, and I do refer people for acupuncture when I feel like it's a good modality for them, and if they're interested in it. So can you talk specifically about specific interventions using traditional Chinese medicine and or acupuncture for depression specifically?
Yeah, absolutely. One of the things that I always feel so honored is when my new patients are like, wow, this is the most comprehensive medical intake I've ever had. They've
Mhm.
probably been to plenty of specialists, plenty of Western doctors. And so the skill of observation is the primary modality that we start with, is asking what's called the 10 questions, which I always joke, it really feels like 100 questions, because we're literally talking top to bottom, inside and out, energy, hydration, thirst, do you have aversions to wind, cold,
Right.
things like that. So
Mhm.
the intake process is really essential for understanding what the imbalances are. And
Mhm.
from there, the interventions are a varietal, right? There's no one size fits all answer in traditional Chinese medicine.
Mhm.
Every treatment is different. Every patient is treated differently based on their presentation. And
Mhm.
so we would use specific points. Like there's a point combo called Buddha's triangle. Okay. It's on the wrist. It comprises the lung, the pericardium, and the heart channels, which these are great acupressure points. If you're ever feeling a sense of depression, you
Mhm.
can put your hand up, and you can utilize these points, right?
Mhm.
So
Right there.
yes, right there, right on the crux of the little snuff box here.
Right.
You can feel it. There's a little hole in there, right? You can kind of feel this
Yeah.
sensation in here. The other one is right on the other side of the ulnar tendon. Okay, so
Hmm.
you just fall off the ulnar tendon. You can either use a finger, you can use a nail. If you even have
Right.
like a pointed crystal, you can use a pointed crystal. These are two great points. And then the next one is about 3 fingers up. We call it
Uh-huh.
two soon in Chinese medicine, and right in between these flexor tendons here, okay?
Uh-huh.
So these are points that you can utilize acupressure on, right? If you can get all 3 fingers on there, it's a skill, definitely unique. But these are a common point protocol that we do called Buddha's triangle. Now, the lung is our storage house of grief. The
Hmm.
pericardium is the heart protector. And obviously, the heart itself is what deals with a lot of our mental emotional states.
Hmm.
So oftentimes I will needle these points to create change. There's another point combo called the crown of happiness, right? So how
I
love,
like that
crown
term.
of happiness. And it's either 3 or 5 points right on the head. So there's one right in the middle, just kind of right in the hairline. It's a great point to tap if you've ever heard of EFT. It's a kind of a
Mhm.
modernized
Absolutely.
acupressure trauma release
Yeah.
emotional freedom technique. It's really incredible. This point
Uh-huh.
is always tapped in there
Right.
because of its ability to help the mind. So
Right.
there are point protocols that are very, very specific for helping to relieve symptoms of depression. We
Hmm.
also talk about what's going on in their lives. Now, I again tell my patients, please have a mental health practitioner on your team. Go
Hmm.
see a therapist. I refer to my local therapists all the time, but sometimes they don't always feel as comfortable expressing the way they do in our treatments. So
Hmm.
I always create space. That Hakomi practice comes in to listen and
Hmm.
to reflect and to ask questions and to support them in creating a life which they feel more empowered and enlivened in.
Hmm.
The other component is the herbal aspect. There are a ton of herbal protocols, including some flower essences from like a company called Lotus Wave that's just
Hmm.
so amazing. And we do everything from like the roots and the leaves and these like really traditional Chinese medicine, like Ganmai Da Cao Tong, which I know is a mouthful to say, but it's this kind of they call it zang zhao, where things are just not really making sense. There's almost like a sense of mania, which can often follow depression, right? Where the mental health component is just not rooted. So we
Hmm.
utilize herbs, we utilize acupuncture protocols, we utilize lifestyle modification, and a lot of these techniques can be really helpful. Back to the tapping thing, this little center part right over the sternum is
Hmm.
called Conjure. Okay, it's the original source. And you can tap this area to help release tension, pain, and sadness from the heart. You can also tap right in the pectoral triangle, right? There's a
Hmm.
here called, oh my gosh, it's escaping me right now, Zongfu. I think it's Songfu, but it's lung one, and it's another great point to tap. So we
Hmm.
work on utilizing different approaches and finding the best technique for them, as
Hmm.
well as bringing in other practitioners and
Right.
making sure that they're not eating foods that are triggering sensations of depression. I can't tell you how many patients I've had that feel imbalanced in their mental health. And then I'm like, well, have you tried kicking the gluten out of your diet?
Right.
And they'll
Right.
get off gluten, and all of a sudden they start feeling more like themselves again. So
Right.
we're really looking at the whole picture to find what the right intervention is for
Right.
them.
Right. Yeah. Well, there's a lot of overlap between what you do and what I do in my practice. Yeah, it's very important to find all of the root causes and address, the 5 areas for me have been foods, infections, toxins, stress, all of which can affect your hormones. And when you find balance in all of those areas and reducing inflammation and opening up the detox pathways in order for all of that inflammation to be excreted, right, and removed from the body, then the body is then given the opportunity to heal, because all of the barriers have been removed. And so I think you're talking the same language in so many ways. Tapping is so important, and we have talked about tapping in previous episodes. And it's been a while since we've talked about it, so I'm really glad that you brought it up. But tapping different points, I always wondered about this point.
Uh-huh.
It's not my favorite point, but there are some people who do have. My favorite point is right around the eye and under the eye, and
Uh-huh.
like, so there's different points and different patterns, everybody, to learn. And if you ever want to learn about that, we've talked about tappingsolutions.com.
Yeah.
Ortner and his wife were big on that. I think they've been really big drivers of teaching the world about tapping. So I'm so glad you brought that up. Yeah. Is there any other things that you would like to talk about in your realm that you have found helpful for, helping people to cope or resolve depression, and maybe even other symptoms besides depression, like anxiety? Um,
Yeah, we work a lot with the nervous system. So recalibrating the CNS so that we can get ourselves out of fight or flight. And
mhm,
there are so many awesome tools out there, right? There are things like a Sensate that you can just order that sends a certain vibrational frequency into the heart to help tone the vagus nerve, to help get you out of that fight or flight and
mhm,
recalibrate into a parasympathetic state. Last year, I did an incredible training with Dr. Jeremy Steiner. He is already a doctor of acupuncture and Chinese medicine. He's now in the middle of his MD. Bless his heart for going back down that route, because he really wants to revolutionize the field and the practice. And
mhm,
he has taken something called e-stim, which is an electrical form of acupuncture, where you take little tiny clips and you stick them on needles with very specific frequencies. But he
mhm,
really up-leveled the game because he's done a lot of research and found these certain frequencies called Noget frequencies that tend to have a more profound effect on the body. So he, through many, many hours of research, like I'm talking, he's sitting there with his blood electron microscope,
mhm,
watching the blood as it's changing, taking HRV, watching pulse ox, doing all of these things to really see what's happening in the body. And he's taken this system and made it super applicable. There are a couple points, and I will go ahead and just fair warn you, these are very, I call them grown-up points, right? I mean, they're very serious. We have a couple other grown-up points that help with anxiety and depression that I always warn my patients. I'm like, take a deep breath. But there are a couple points right near the Adam's apple. And as you can imagine, this is right where the vagus nerve is. And you utilize a very gentle stimulus. It's a 4.6 frequency, with the other end of the spectrum being a 146. So you get what's called a blanket frequency. And you
mhm,
utilize this with a couple other very specific points from his techniques to actually charge up the system. It's kind of like charging a phone, but for your body. And it's really incredible. You can take people out of sympathetic lockup in one treatment by
mhm,
really just sending this frequency right into the vagus nerve. And what I
mhm,
find is that people are able to regulate much more consistently and easily, whether it's anxiety, depression, reactionary stress, and trauma. When you get the system back online and you start calming down that sympathetic response, everything seems to fall into place. So, in Dr. Steiner's research, you can actually see the blood, the consistency and the quality, the terrain in the body changing. So,
mhm,
blood is supposed to be right negatively charged on the outside so that it's floating around and not getting coagulated and overlapped. But most of us, through toxins and stress and glyphosates and alcohol and all of the things we experience in life,
yeah,
actually depolarize the blood, which is when we start seeing disease. That's when we start seeing, arteriosclerosis and atherosclerosis and even beyond. So he has found, by utilizing this, and we're talking for him in his original research article, and this is put on PubMed, it's peer-reviewed research article, he's actually able to show that you can repolarize the blood in just 4 sessions by
mhm,
sending these very specific electrical impulses into the body. Because we
mm,
all know we are energy, we are
right,
made of energy. Our body knows exactly what to do with these frequencies and energy. And
right,
over time, the blood repolarizes, the macrophages and lymphocytes turn back on. They start doing their work, cleaning up the interstitial space, removing the bacteria and the pathogens. They even show one of it mobilizing the macrophages and lymphocytes to go and break down and kill parasites. So these could all be parts of the mental health component that we're talking about here. And when you really work on the terrain and really work on the system, finding these comprehensive approaches, working with multifaceted practitioners, we see big changes. I've worked with countless patients who have been on the prescriptions, who have done therapy for a decade, who have tried every approach under the sun and not really gotten the changes that they're looking for. And when we start to get down to these constitutional components, they notice that their lives change, that they feel much happier, and that they're able to kind of unwind from this component of mental health imbalances.
Right, right. I appreciate you bringing up the sympathetic drive that people kind of walk around in this state, and they don't realize it. Nobody else realizes it either, especially the conventional or standard community of Western medicine, especially because it's part of our culture to go, 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 go. This drive. And so it's just like, well, that's the way you're supposed to be. It's like, nope, the body's not supposed to be like that. And so we get so much information from the media, mostly the media, I would say, about how you should be operating, when that's just not physically possible. Up to, you can do it for a short time, but it's really, really hard to maintain if you don't stop and fuel your body, rest your body, right? Rest your mind, take breaks. And so it's really important to be able to recognize that. And as practitioners, you have been, with your history, getting a really good history and observing, like you said, it really helps for us to pick up on that. We're not doing anything special. We're just doing something that other people don't do. Like you can't do all of that in a 10-15 minute session. It is spending time with your patient and really connecting the dots, getting more puzzle pieces. And if something's not clicking, it's like, okay, I'm missing something. Let's go back to the drawing board and let's figure this out. And it takes a lot of time to be able to do that. Yeah. So I want to go back to something that you said, that you said they were grown-up points. So when you say, so I'm assuming you like, don't do this to yourself. You really want to like work with someone, right? And so the practitioner, are you telling me that the practitioner would, obviously, just determine if this is right for you, and then put points with their fingers, or is there a device involved? That's what I'm curious about.
Great question. Yes, you definitely want to work with a licensed and skilled practitioner for these approaches. Do not get a TENS unit and stick it on your throat. It's probably not a good idea. Might cause some more problems. But if you work with someone who is trained in what's called EAM, Electroacupuncture Medicine, they probably know this technique. It is 1 or 2 acupuncture points, literally right on the side of the Adam's apple. And the points, and I know this sounds so scary. The first time I did this in grad school, it was terrifying. I have since overcome that fear. But you take 2 acupuncture points and you stick the needles directly in. Now, they might be 1 on each side if you're in a really severe lock. It might be 1 connected to the wrist, similar to that area we were talking about before, and 1 in the throat. And take these really super tiny alligator clips. They are very different than what we see. These kinds of clips, they actually kind of like clip around the needle, and you place them on these 2 points to create a circuit. Now, there's typically 4 different points in this EAM protocol, but in this would be 1 of the connective points, and it would likely, if it was connected to the wrist, be that 4.6 frequency. And so you'd actually be receiving that electrical frequency into the body via the needle, and the needle is typically taped down so that it doesn't wiggle or move, and it can send that frequency into the vagus nerve and help the vagus nerve regulate itself, calm down, get out of that sympathetic lockup. It's absolutely beautiful. Every patient I've done this on has been like, wow, I feel significantly different. And then they notice that they're kind of able to handle life better. They're not as charged. They're not as frustrated. They're not feeling as sad or, grieving as much, because we're able to actually create change in the nervous system.
That's awesome. That's really awesome, because, we talk about doing vagal nerve stimulation with using different practices like humming or singing, and then there's a whole list that we provide our patients, and sometimes that just doesn't do the trick. And then there are all of these vagal nerve stimulators devices that you can get as well. It's really great to know that there's a specific acupuncture technique that we'll put in the show notes if people want to learn how to find someone who does that particular technique, because I think it's sometimes people need a deeper dive in order to create a shift, and that's what it feels like. That's what you're talking about. Some people really need that deeper touch, so to speak. Yeah.
It's like taking humming and turning it all the way up.
Exactly. Yeah. I mean, you can only do so much humming, right? So everybody's different, and it's a matter of trying these things and then ramping it up. And I talk a lot about vagal nerve stimulation, and the other thing that really helps is looking at limbic activation. And so there are programs for that as well. I'm wondering if there's anything that you do for that specifically as well.
That's interesting because Chinese medicine in general is benefiting mind, body, and soul. And, when we think about it, I'm like, okay, what specific things are, correlated with limbic action? And one of the things that I love is how science is catching up to Chinese medicine. So when you actually receive acupuncture, there are physiological things that happen in the body. Okay. You're using metal, right? These tiny, super fine needles. I mean, they're literally like a couple strands of hair just inserted into the surface of the skin. And these points that are proven with cytotopography, you can actually see these points on CT scans as areas of less electromagnetic resistance. So we're using metal and water to conduct electricity through the body and send stimulus to the brain. Now, when the stimuli get to the brain actually releases endorphins, enkephalins, cytokines, oxytocin, nitric oxide. So all of these things can affect you on a very intrinsic level. I'm like trying to think, like, are there specific limbic action points? But we aren't really always thinking about things in those kinds of terms in Chinese medicine, where the overt effect is really going to help the brain, help you release these feel-good healers, and really help your system heal from the inside out.
Right. Yeah. I'm talking specifically about the amygdala just going wild, right? So triggered, when people are really triggered. And yeah, I know it was not probably the fairest question, but I was going to see how you responded to that. And I appreciate your response because I agree with it. I mean, sometimes it is it's a combination of things coming together and making small shifts over time that then unlocks something bigger, right? And so I was just curious because it's not part of my field. And, sometimes there is something that's like, yeah, we have this one point.
And there are actually some points that are kind of in this area, right? There's one that's called the back door to the third eye. It's also known as the wind gate. And it is literally like right near the stem back there. So I would imagine, but there's not necessarily like a direct translation, like, oh, this will stimulate amygdala responses.
That's fine. That's fine. Yeah.
At least not that I know of. I'm sure there are if I were to go in deeper.
Yeah, I appreciate that. Yeah. So yeah, I have, we're running out of time. I've really enjoyed this conversation. Is there anything that we haven't talked about that you think is really important for you to mention today?
That's a good question. I think empowerment is so essential when it comes to something like this. I have a lot of patients who will come in, they have tried the pharmaceutical route because their provider decided that may have been the best choice for them at the time, and they still feel horrible or feel maybe even worse. Some of the side effects of some of these pharmaceuticals are literally self-harm and psychosis and, delusions and things like that. So make sure that you're asking questions. I love that we're getting more integrative in general, but I've had some of my patients go, yeah, I had like a 15-minute appointment with my psychiatrist and then they prescribed me this. And unfortunately, what we're finding more and more, especially with modern research, is that a lot of the pharmaceutical interventions for mental health are kind of a shot in the dark sometimes. We don't know how, what, when, why, or if they're going to work for you. And some of them can be absolutely life-saving. I am not downplaying the fact that it can really create change for some people. But oftentimes it's like, well, we're going to try this for 6 weeks. If it doesn't work, we're going to try something else. And if that doesn't work, we might bring in Abilify or something else to try and help it work more effectively, things along those lines.
I call it
So
the medication merry-go-round.
oh, that's a good one. The medication merry-go-round. So
Yeah.
please make sure if you are on the medication merry-go-round to get off the ride sometimes, to talk with your prescribing practitioner, to integrate your holistic and multifaceted practitioners into these conversations. I always tell my patients, if you want us to have a group call, we can get on the phone, we can talk together, because they're not a forever solution for a lot of people. It might be helpful for a certain amount of time, like if someone needs to really get out of a rut, but it might not be that you should be on this prescription for the rest of your life. So just really pay attention to the symptoms, empower yourself, utilize the tools, right? Consistency is key with things like tapping and humming and acupuncture and therapy and all of these incredible tools out there, and know that there is a way out, right?
Absolutely.
You have resources like this incredible podcast, and there's so many people out there who just would be more than happy to support you in figuring out how to rebalance your system, get out of the symptoms of depression. And if you are wanting to, with the guidance of your prescribing practitioner, to titrate off of those pharmaceuticals as well.
Right. Great. Yes. Nice overview of, how I think people should approach it and know that they can be empowered and that there's lots of solutions out there. It's just a matter of looking for them. And even if you try something at home, if it doesn't work, it's possible that you might not be doing it right. You might not be doing it enough. You might not be, doing it long enough, or, so there's different variables. And so it's a matter of working with someone to help teach you the right order of things. Sometimes you might do something, but you have to do something other, before that, in order for that one thing that you're working on to be more effective and create shifts. So, having a practitioner is really, really important that's trained in these areas. So, well, thank you so much, Diana. I really appreciate you coming today and talking about what you do. Why don't you let the audience know where you're located? And I would love for you to also indicate how people can find someone that does that specific type of acupuncture if they're really interested in going that route.
Yeah, so I am in Austin, Texas. We're actually expanding into a new space. Like I mentioned, used to be part of a collaborative and integrative facility, and I'm now spreading my wings to open my own facility with multifaceted practitioners like shamanic healers and massage therapists and mental health. And we'll have something called the Self-Care Sanctuary with vibroacoustic sound healing, red light therapy, PMF, HBOT, reflexology, and that is via Moon Medicine Magic or the Sanctuary ATX. So that's for Austin. And then let me see if I can find this. I will definitely send the link to this. This is called EAM. So you can find information for practitioners at electro-acupuncturemedicine.com, and there's a directory on there. So it's called EAM, electro-acupuncturemedicine.com, and there's a directory right on the top, and you can find practitioners all over the United States who are able to provide this type of technique.
Great. Thank you so much. And I appreciate your time. And I wish you well with your new facility and practice.
It's an honor to share. Appreciate you.